I'm Dr. Heather Nelson, and this is a 5-minute pedagogy class. Today we're going to start talking about the thyroarytenoid muscle, or the TA, which is so fascinating and so complex. I'm going to have to divide this into at least 2 different videos to get through it all. But for today, we'll start with where it is, what it does, and some ideas for how you use the TA in the studio. Let's start with orienting. Like a lot of muscles in the body, the name of the TA can give us a clue as to where it is. The first half of that name, thyro, refers to the thyroid cartilage, where the muscle attaches or begins. The second half of the name, arytenoid, refers to, of course, the arytenoid cartilages at the posterior part of the larynx, where the muscle inserts or ends. The muscle itself is just amazingly complex, and so I'm going to get into the structure in another video, so hang on for part 2 coming your way pretty soon. But for today, the basics of it is that the muscle is V-shaped, bilateral, and mirror imaged. That means that, of course, it's shaped like a V, has 2 sides, and the sides move together in mirror images of one another, unless there's been some sort of a disease or damage to the nerve where the muscles move independently. But generally, they'll move together. If you were to look through the side of somebody's head, you'd see the TA laying horizontally about in the middle of the larynx above the windpipe. If you were to take off somebody's head and look down their throat, you'd see a smaller version of this. This is the front and this is the back. This orange part here, that's the TA. And you can see that it's V-shaped. When it's open, you can look through and go down the windpipe. And then when it's closed, that's when we can phonate. This front part here, the point or the apex of the V, that attaches to the back side of the thyroid cartilage, it's a fixed part of the muscle. It doesn't open, and it just follows the thyroid cartilage as it moves. The back part, where the muscle inserts to the arytenoid cartilages, that's the part that moves. And so when other muscles act on those arytenoid cartilages, they can pull the TA open or relax and let it close. When it's open, we can, of course, again, look through the windpipe, and that's when we are allowed to breathe. When it closes, it can vibrate for phonation, or it'll just close up to protect the airway. The main function of the TA, in fact, the main function of the entire larynx, is to protect our windpipe and our breathing apparatus. When we swallow, or if there's some sort of a threat to our breathing, the TA and the false folds and the epiglottis will all close up and give us triple layer protection to keep anything out of the windpipe that doesn't belong there. We can feel it working if we happen to choke on something or something goes down the wrong pipe, and we have that violent reflexive reaction that is the body just keeping whatever that is out of the windpipe. The fact that we can make sound with the TA is just a really nice bonus. When the TA comes together to vibrate, it couples with aerodynamic pressure from the lungs and vibrates at the same rate of the sound wave that you're producing. For instance, if you are singing an A440, which is the tuning note for an orchestra, your vocal folds will vibrate at 440 hertz, or 440 times per second. That's so fast that we can't actually see that vibration with the naked eye. And so if you watch videos of the vibration of the vocal folds in action, you're seeing them through or with the help of a strobe light, which helps to visually give us the impression of the sound of the muscles slowing down so we can see the vibratory pattern. In the studio, the TA is one of the muscles that's responsible for our onsets. We have 3 basic types of onsets. We have breathy, balanced, and glottal or pressed. All 3 of those types of onsets can be useful in one way or another, and we can make choices to use them in an artistic way. I think most of the time that we want that balanced onset to be our default. We can talk about how the other 2 can be helpful at another time. But for us to get that balanced onset, we have to work at getting the muscles to come together cleanly and that air pressure to start at approximately the same time. So to get the TA working well, you really want to work on getting a good balanced onset. I'll have some tips for that in another video as well.